All right, we'll now reconvene and we're going to return to two patient advocacy updates. And I think that in the spirit of providing practical insights and useful tools and information for all of our participants today, we're going to go first to Molly McDonnell from Fight Colorectal Cancer. And what she's going to address here, as you see, is this Catalyst state-by-state advocacy program. We want to understand is, given the diversity in our nation, how big it is, and how many people need these services, how does an outfit like Fight Colorectal Cancer go about acting as a catalyst at that state-by-state level? So Molly, welcome. It's great to have you on. What do you have for us?
Great. Thanks, Cliff. And thanks to NCCN for putting on a great event today and for having me. So as Cliff mentioned, my name is Molly McDonnell, and I'm the Director of Advocacy for Fight Colorectal Cancer. And for those of you who aren't familiar, Fight Colorectal Cancer is a national nonprofit advocacy organization. And we were really founded in the spirit of advocacy, and that's really the cornerstone of what we do. But in addition to that, we also support high impact research, provide balanced patient support materials, and really work to empower patients and their loved ones to affect policy change for the good of the colorectal cancer community. Next slide, please. So today I'm going to talk a little bit about our Catalyst state-by-state advocacy program. So for Fight CRC is about 15 or 16 years old, and our focus had primarily been at the federal level around advocacy. But over time, we were able to build a really incredible network of patient advocates all across the country. And with so much happening at the state level, perhaps now more than ever, we really wanted to, get involved at the state level and help our patients, our advocates, be able to engage with policy in their states. And so we created the state-by-state advocacy program last year. We launched it officially in January, so a couple of months before COVID hit. So it was obviously an interesting year to launch a program like this, but the intention behind it was, really to help accelerate progress towards turning aspirational colorectal cancer screening goals, such as getting 80% screened in every community, turning those goals into reality by reducing barriers to colorectal cancer screening. And so for our first year for the program, our priorities were really around ensuring coverage for colorectal cancer screening beginning at age 45, in accordance with both ACS guidelines and, as of recently, United States Preventative Services Task Force draft guidelines that we hope will be finalized in the early part of next year. In addition to that, we are also working at the state level to remove patient cost sharing for colonoscopy following a positive non-invasive screening test. So this policy priority became even more important in light of COVID, as healthcare centers were shutting down and non-essential services were being delayed. Colorectal cancer is unique in that there are at-home non-invasive screening options that can help with patients keeping up to date on screening. And so, if a patient were to get a positive result on one of those non-invasive tests, it's critical that they receive a colonoscopy to confirm that positive result. And often that out-of-pocket cost that can often occur with that follow-up colonoscopy is a significant barrier. And so we've been working with our first cohort of states to advance those issues. And so, as I mentioned before, Fight CRC is a fairly small organization. So we're not at the place where we're going to have chapters in all 50 states, at least right away. And so we wanted to think about, how can we still have a presence in these states? How can we be the most helpful with the resources that we have? And so we decided we would provide grant funding to a handful of states and help them to build coalitions, bring together the key stakeholders needed to advance this work, and help them to, create a plan around their policy efforts. And so in addition to kind of technical assistance and grassroots support that we provide, we also provide each of our grantees access to a professional facilitator who runs them through a robust action planning process. So they get all of the key players into a room together, virtually, of course, this year, but they're able to talk through, what challenges do they anticipate? How can they overcome them? What data and resources and different deliverables do they need to be able to get these policies over the finish line? And so it's been a really great process that we hope will also help them build, sustainable infrastructure and sustainable coalitions to help beyond just the life of the grant cycle. And so, our hope is really that as we expand into additional states, that we are able to create this network and develop best practices and resources that can help the states that maybe we haven't been able to provide funding to yet. And so, we really want to be able to create a one-stop shop resource so that for states or patients or advocates, individuals who are interested in getting involved in this work, that they have a place to come and where the resources are centralized and available to them. And so in our first year, as I said, we provided grant funding to 4 states: Arkansas, California, Colorado, and Louisiana, which I will talk a little bit more about those states specifically in a little bit. And just about a month or so ago, we announced our next round of grantees, which is Kentucky, Nebraska, Rhode Island, and Texas. Next slide, please. So as I mentioned, we really want to create this one-stop shop for advocates. And so as part of the Catalyst program, we developed an advocacy portal as part of Fight CRC's website. And so this is a place where it's hosting all of the resources that we're developing throughout the course of the program. So this is everything from one-pagers on all 50 states that have an overview of the landscape of colorectal cancer screening in that state, both from sort of a data perspective, but also from a policy perspective. So what's the screening rate in your state? Does your state have statute currently in place around colorectal cancer screening? If it does it follow ACS guidelines? Does it follow USPSTF guidelines? So it's a way for an advocate or a patient who's perhaps not very familiar about what's going on in their state to come to the website and learn a little bit more about what's going on in their state and what more needs to be done. We also have draft legislation and draft testimony if someone is going to be testifying before a legislative committee. We have one-pagers on our policy priorities. And so it's really something that is created to grow with us. And as we continue to, develop assets throughout the course of the work with our grantees, this is a place that we can store all of that and folks can have open access to it. Another thing that we've included on here is a series of webinars. So we've talked to advocates in states that have successfully passed colorectal cancer related legislation and asked them, how did they do it? What were their challenges? How did they overcome those challenges? What's their best advice as you're getting into this work? And so it's another way for folks to start to build those connections. And again, get the sort of tips and tricks from states that have done this before without having to recreate the wheel each time. Next slide, please. And so, like I said, obviously 2020 was a much different year than we originally anticipated, but despite that, we were still able to have great success in our initial Catalyst states. So in California, they were able to identify a lead sponsor for their legislation, which was around removing out-of-pocket costs for the follow-up colonoscopy. And we're able to gain co-sponsors and move that forward before the legislature shut down due to COVID-19. In Arkansas, this was actually a budget year for them. And so they were focused primarily on the state screening program in their state and plan to introduce legislation around the follow-up colonoscopy issue this year. But even in a time of COVID-19, when there was incredible strain and cuts to the state budget, they were able to get an increase of $50,000 for their state screening program. Colorado was also able to advance legislation in their state. It was able to pass the House Our grantees were able to testify before a House committee about the importance of the legislation. And they were getting ready to testify again in the Senate. And then, of course, COVID-19 had other plans. But each of these states were able to take the time when the legislature shut down to really regroup and think through what additional data or resources they need and work to be able to really hit the ground running in 2021. And so we're excited to do that with them. And then the last state I'll talk about from our first year is Louisiana. I saved them for last just because they have taken a slightly different approach in terms of how they're engaging around these policy issues. So we like to say we support both big P and small p policy work. So in Louisiana, instead of working at the legislature, they're working directly with some of the largest payers, health insurers in the state of Louisiana, to engage them and urge them to make these policy changes internally, rather than having them come from the state legislature. And so our hope is that they can create a good case study to move forward and ultimately advance legislation. Next slide, please. Okay, I know I only have 30 seconds, and so I'll wrap this up quickly. But as I mentioned, we also are expanding into 4 new states this year that we're really excited about: Texas, Rhode Island, Nebraska, and Kentucky. I won't go into the details about what each of them are working on specifically. I'm happy to share these slides, but we're excited to continue to advance into different states and also to expand our coalition of folks who are working together and working across states to help each other advance policy and increase access to colorectal cancer screening. So with that, I'll stop there, but again, appreciate the opportunity.
No, I thank you very much. And I know that you did say that Fight Colorectal Cancer is a small organization, but I happen to know that, as they say in the world of boxing, they may be small, but they're fighting above their weight. And I have to ask you a quick tactical question, if you don't mind answering briefly. How do you set priorities? You got 50 states and territories and so forth. Can you just give us a bit of insight into how you kind of make those choices if you can't go in all 50?
Yeah, so in terms of, we really do want to listen to the states and what's happening with them. We know that each state is different, to your point, and we really don't want to prescribe a one-size-fits-all approach. However, these issues that we've identified are some of the really sort of top issues that we're hearing from patients that are facing the colorectal cancer community. But we've also worked with our grantees, and we'll work with our new set of grantees in this new year around issues that may be unique to their state around colorectal cancer. And so we really are not overly prescriptive in how we work with states and how we kind of determine what they're working on.
So it's kind of issues driven from the state up, it sounds like.
Yeah, absolutely.
Got it. Good. Thank you very much, Molly McDonald from Fight Colorectal Cancer. And we'll move on. Thank you.